Hello everyone, it's Better Bob, and this video is about the difference between blood sugar and insulin. You know, a lot of times I get notes from people saying, my insulin is good. I test it after I eat, and I have to write back to them and say, and a lot of you know this already, but stick around. Even if you know this, stick around because you might learn something from this video. I write back to them and I'll say, you can't probably know what your insulin level is after you eat. What you're testing is blood sugar. And blood sugar and insulin are two very different things. And they're not always synonymous with each other. They don't always match each other. In fact, they don't match each other very often for a lot of people. And that's what this video is really about. And this is kind of a complex issue, and I've wanted to do a video on it for a long time. But, trying to find a way to talk about this that is understandable and that will mean something to you in your practical everyday life is something that I'm always concerned with. Last year, in October of last year, 2015, I took a insulin test, actually a test to test my insulin levels, both when I'm fasted and after I took a glucose load of just pure sugar to see what would happen in my insulin levels. This test is called the Kraft prediabetes test, and it's a blood spot test that you can order from a company called Meridian Valley, I think is the name of it. Yeah, Meridian Valley Lab. Now, I'm not promoting Meridian Valley Lab on here. I don't get any money from it for this channel or anything else, but I have used them, and I always limit what I say on this channel to something that I have done myself and that I know has results that I can depend on, so I can pass those on to you. Listen, guys, blood sugar is something that you can test very easy. Back in the late 60s, 70s, they developed a fairly easy home test that you can do, and it's gotten better and cheaper as it's went along. You can prick your finger, you can prick wherever you need to prick on your body, and you can get a little blood. And these test devices are you can buy them anywhere, and you can find out what your blood sugar readings are, both when you're fasted and after you eat or whatever. You can do tests, and people do this. Lots of people do this, and in a lot of ways it's really good because you can kind of test how food is doing, what it's doing to your body. We're all different. People respond to foods differently. So, you really need to know what some foods are doing to you. But the focus of this channel has always been, from the very beginning, not on blood sugar, but on insulin. And honestly, at this time, 2016, as far as I know, there is no simple, immediate home test for insulin. If there is, someone needs to write me and let me know about it, because I'd like to know about it. As far as I know, to get your insulin levels tested, you have to either go to a doctor and get a test, which may not help you, and we'll explain that in just a few minutes. It'll help you a little, but we really need to know more than that. Or you can order a test. As far as I know, there may be more companies that do it, but I know that this Meridian Valley, and I've got my test right here. Meridian Valley in California has a test that you can order. They send you a little packet, and I'll show you more about that later. And you take and prick your finger, and you have to do little 5 blood spots for every hour for 4 hours to see your insulin patterns, not just when you're fasted, but also after you've had a sugar load in your body. And the reason they do that, they're testing something based on the research of a doctor that I greatly admire and have talked about lots of times on this channel, Dr. Joseph Kraft. Dr. Kraft at this time is still living and vital and active. He's in his 90s. And there's a great video interview with him here on YouTube by Ivor Cummings. And that's a video you need to see, and I'm going to link to it in this in this video. You need to go over and watch that video so you can learn much more about Dr. Kraft, actually from him and from Ivor. And Ivor's channel is great, by the way. It's if you're the kind of person that likes to get some more in-depth learning about this stuff, that's a channel you need to watch for sure. My channel's more entry level, but Dr. Kraft learned. He was a doctor and still is a doctor, but not practicing at this time. He was a doctor that learned that people have a hidden problem that they don't know a lot about. Everybody depends on blood sugar, either their fasting blood sugar or they can take a glucose tolerance test, where they take a glucose load and they look at their sugars after that, and that's how they diagnose them with diabetes. But blood sugar and insulin do not really match each other. For example, you could have high blood sugar and you can have very low insulin, and that's what you would call type 1 diabetes. Or you could have fairly normal to even high blood sugar and have also high insulin. And we would call that type 2 diabetes, because the insulin is actually high in type 2 diabetics, but because of insulin resistance, and that's really what type 2 diabetes is an insulin resistance disease or an insulin resistance problem. The insulin is high, but your body doesn't react to it the way it should. So there's an example of blood sugar being fairly normal or a little above normal, or maybe even a lot above normal, and insulin also being very high. So that's not a match. But Dr. Kraft found something even more important for people like you and I. He found that about 80% of people who would pass a blood sugar test, fasting blood sugar test, or a glucose tolerance test, would, if they took his test, which tests insulin levels, they would fail that test. They would not only fail it, but they would be what he would call a diabetes in situ. In other words, they were what we would call pre-diabetic. They have this underlying hyperinsulinemia. There's a $2 word for you if you ever heard one. Hyperinsulinemia. Chronically high insulin levels that are underneath and unseen, and for the most part, by most doctors, not tested at all. And so for years and years and years before they get this diagnosis of type 2 diabetes, they have this high insulin pattern going on underneath the hood, and they don't even know it. Their doctors don't know it. No one knows it. And if we tested for it, as Dr. Kraft has pushed almost to, and no one's listened to him, but I think they will. We could probably find people who were in trouble decades, maybe 2 decades, or at least 1 decade before they were ever diagnosed with diabetes. They would know that they were heading that way. And this is something that you need to know. The problem with this Meridian Valley test that I took last year, 2 things. One, it's expensive. Yeah, this test is like $200. You can order it. It's $200 out of your pocket. It comes and you've got to fast for the whole night, which a lot of you do anyway. And then you got to drink some nasty pure glucose and you got to test your levels by pricking your finger and getting blood spots, pretty big blood spots, I might add. And you pack all this stuff back up and send it off. And I got mine. See, I did it in October. Let me see. I've got it here on my computer. I've got it. I did it in October of. I did it October 13th of 2015, but I didn't get my results back until November the 2nd. So it was a good 2.5, 3 weeks before I actually got my lab results back. And I was pleased with the results, but that tells you how difficult it is to get this test and the results back on the test. So when someone says I know what my insulin level is after I eat, I know for sure that they're a little bit confused on that, because as far as I know, it's not possible to know that fast or that easy, not at home. So this is really important. And the biggest thing that we need to know about Dr. Kraft's work is that he tested well over 10,000 people in his career. And like I told you, 80% of them that looked good as far as blood sugar goes looked bad as far as insulin goes. And so this is a problem that people don't even know they have. And this goes to the very heart of diabetes. It goes to the heart of obesity. Listen, guys, insulin is a hormone that stores fat. I mean, we talk about that all the time on this channel. But insulin is also a hormone that in high levels in your body, without you knowing it, is setting you up for diabetes. It's setting you up for obesity because it's storing fat, but it's also doing damage to your the vessels of your heart. The whole high insulin problem, or hyperinsulinemia problem, is related at its very root to so many conditions that fill doctors' offices all over the world, especially in the developed world, what they used to call the Western world. Heart disease, diabetes type 2, skin problems, joint pain, chronic joint pain, obesity, as we've talked about, polycystic ovarian syndrome. So many problems, too many to list actually. And I actually did a video on this last year. It was a little long, and it hasn't done all that well, but it tells you that insulin is really the root cause of modern illnesses, the chronic modern illnesses that we have. And so you really need to know that there's a big difference between these two things. Blood sugar, insulin. Blood sugar is really a side effect of an insulin problem, not the other way around. Not the other way around. Now, say you don't have $200. Listen, I never tested my insulin levels the entire time I was losing weight until I had lost my weight for a long time by the time October of last year came around. So I lost all the weight without ever knowing my insulin levels. So what do you do if you don't have the money to get one of these tests? Well, it's easy. If you're losing weight, and I'm not talking about weight on a scale. We've already discussed how unreliable a scale is. If your belly's coming down, reducing, your fatty areas in your body is coming down, your insulin levels is coming down. It just is. And if you're fasting, if you're eating low-carb foods, you are reducing your insulin. We talked about in my video, Why Are Fat People Hungry? We talked about the relationship between being fat and chronically high insulin. These things are related. Now, not for everyone. There are some people who do not get really fat on the outside, but they get very fat on the inside. And these people, and I'm talking about fat around their organs and their liver and around their organs, they don't appear to be fat on the outside as much. But it's still a relationship between obese or fat in that area, general area, and insulin levels. But for the most part, if a person is fat around the middle, and the fatter they are, more than likely the higher the chronic high insulin that they have. And this carries on, is a little bit more, and it's like a vicious cycle that builds on itself over years and years of time. And I talked about that a lot in my fasting and the 50% insulin problem. That video dealt with this issue of how this underlying level of insulin is part of the obesity problem that we have. There's two people that I admire, and I talk about them on this channel a lot because I think they're two scientists that had a big part of the problem in mind. And one was George Cahill, Dr. George Cahill, who really basically settled the question of why human beings do not use fat. They have to be in a state of a fasted state in order for their body to switch over and use fat. But Dr. Kraft's work shows us that some people are always and almost chronically, not almost, but they are chronically high in insulin, and they don't know it. And if you just prick your finger, you don't know it. You don't know what your insulin level is. Even if your insulin level is showing normal, you can still have high insulin. Even people on a low-carb diet, even people fasting, even those of you who are losing weight right now listening to and doing what I'm telling you, if you're still pretty fat and you still have not lost all your weight down to where you need to be, you more than likely have higher insulin levels all the time, even though they're reducing, than a normal pattern insulin person. This is important for you to know. That's why you need to continue with this program and fix this problem. Fix it over time. Don't stop short with this. Keep working on it. And this is the reason why, if you allow yourself to eat and munch all the time and you go back into your patterns that you had before, even low carb, but you're eating a lot, you're doing yourself not very much good. So, guys, listen, this is the most important thing that I want you to get from this video. Your insulin levels are different than your blood sugar. To know your insulin levels for sure, you'd have to get a test. That Meridian Valley is a place that you could get that test. You could go to a doctor. But really, we need to know what your insulin does after you eat. For more on that, you need to watch my video, Why Are Fat People Hungry? And that'll tell you why it's important for you to get tested after you have some sort of food in your mouth, in your body, to see what your insulin level does after that. Because there are people who have a fasting insulin level that's fairly normal, but after they eat, it goes real high, and it stays there for a long time. For the most part, though, if someone is heavy, their fasting insulin level starts creeping up, creeping up, creeping up. Like I told you in my fasting and the 50% insulin problem video, the higher that fasting insulin level is, the more likely it is to spike way high, because on average, in that study that I used in there, that your fasting level, your after eating level will probably jump at least 5 times higher than your fasting insulin level. So don't rely on blood sugar as your main sign that you're doing well. It's a good thing to look at, but the reduction of fat in the fatty areas, that's telling you if you're knocking that insulin down. That's what it's going to tell you. So if you can't afford the test, but you're losing weight, as far as your tape measure's getting a little bit skinnier every time, then you're doing yourself some good on that, even without the test. So I hope this has helped you. Remember to write me if you have questions. Make sure you go and look at Ivor's interview with Dr. Kraft. And I also have a little short article about my test and how I took that test that you can get on my website. Thanks for watching. If you like these videos and you haven't subscribed, please do. Thanks for watching. Bye-bye. Hi everyone, it's Butter Bob, and I'm going to do an experiment today, and it's about the Kraft pre-diabetes test. And I got this test from Meridian Valley. It's kind of an expensive test. It's about a $200 test, but you can do it at home, and you can send it in and get the results. And it goes along with the yeah, there's the instructions.
It'll come with a little booklet.
Yeah, so a little booklet, and you can see I've got my glucose test, which I'm going to drink in here in a little while. And here's all the tests for the blood test. As you can see here, show them, Dakota. We've got all kinds of. We got the
You'll
fasting.
first have a fasting, and then you'll have a after you get your fasting complete, you'll drink your glucose drink. After you're drinking your drink, which is consumed within 5 minutes, you'll perform your half-hour step, then your 1 hour step, then your 2 hour, 3 hour, and 4 hour.
There it is, and of course I'm not going to bore you with every detail of the test. We're going to show some tests, but the whole purpose of this is to see what your insulin level is. And it's not just insulin level on a low-carb diet. I'm actually going to be taking this 100 grams of pure glucose. So we're trying to see how my body reacts after a glucose load. Because Dr. Kraft showed back in the 1970s that a low-carb diet, after a year, could change people's patterns back to normal. Could reverse glucose intolerance and change your insulin pattern back to a normal insulin pattern. So we're going to get started.
Okie dokie. So I'm not going to touch your finger to the card.
Don't touch the finger.
I'm not going to touch your finger to the card. I'm going to poke it, make a big drop, milky finger.
And it said something about going across the lines or whatever.
You have to go across your finger. Yep.
This is going to be fun.
It'll hurt.
Oh yeah, it's going to hurt. How come you got two pokes in that one thing?
Because we're going to do 2 different fingers.
We have to do 2 different fingers on each test?
Oh, it's fun.
It says 2 fingers on each test?
What we're going to do...
You're going to run out of fingers. You're going to do your toes.
Wait just a minute here.
Who doesn't trust you, Cody?
It's actually in case your finger doesn't have to poke a different one.
Alright, so here we go. I thought.
Those of you that have never had your finger poked, it's extremely painful. Just a small lancet.
I think it's worse than any kind of IV or anything.
Hush.
Now show the
And we're going to do this middle finger next because it's got more meat on it.
It doesn't go to the bone, huh?
No, I don't worry about that.
Show the camera.
I want to make sure that leave it and let it air dry.
Now you're going to let this air dry overnight before you put it in your bag, so you don't have cross-contamination with the humidity and stuff. You're going to make sure that once you get the blood drops in the line, when you drop this in the drop on there, that it does go through all the way back to the card, because that's actually where they're going to test from, is the back of the card. So make sure it does, leak through. You're just going to fold that over.
I thought you gotta let it air dry.
Well, we'll fold this over.
I thought you had to let it air dry before you seal it.
Well, you're not sealing it. It's just kind of fold
okay.
that over. Kind
You
of
don't
protects it.
like particles flying
You
around.
don't want any dust and stuff coming off of it.
No, I did that. All right. Here is the glucose nasty stuff.
I'm sure it is nasty.
Well, it's lemon flavored, so it should be.
Yeah,
taste a little like Sprite.
I gotta down it, and I gotta do it in 5 minutes time. So I'm just gonna kill it.
It was awful when I did it when I was pregnant.
Really.
Ugh.
Now that's nasty. That's nasty. I would much rather have my heavy whipping cream coffee this morning.